So thank you for making the time to come today. It's really great to see so many faces. And welcome to the information session for the Translational Research Grant Scheme for Round 3. So today is really an opportunity to talk to prospective applicants and also people within our host organisations to share a little bit more information around the scheme, some changes that we've made to the current round, and really just to touch on a few things that will make your application more competitive. So I'll just provide a little bit of an overview of the scheme and, as I mentioned, some of the changes for round 3. Then Dr. Andrew Malat will be talking about partnerships in research. Professor Don Nutbeam will give you an introduction to the research translation framework, which I'll introduce a little bit further down the track. And Dr. Michelle Krotikos will be giving you some practical advice around what TRGS can do for you. And then we'll have a little bit of time for some questions and answers at the end. So I'll just ask that you hold your questions until that time, but we should have plenty of time for all of your questions, hopefully. So I'm sure a lot of you have had exposure to the TRGS scheme before, but for those of you who haven't, the TRGS scheme really funds research that is directly translatable into policy and practice. So we look at funding really practical, really pragmatic research that will have an impact on how we deliver healthcare and on patient outcomes. So projects that are submitted to the scheme for funding must be health system led. So they must come from our host organisations, which are local health districts, our specialty health networks, New South Wales Health Pathology and the Ambulance Service of New South Wales. And so that means that we offer grants to staff within these host organisations, and that might be clinical staff, that might be doctors, nurses, allied health practitioners or public health practitioners. That said, and this is something that we will touch on probably quite a bit today, we really do encourage applicants to partner with other organisations in the research field, so universities, MRIs, as appropriate, to make sure that those research skills are brought into the team as well. So the TRGS scheme is quite unique, and I'll just take you through the process in terms of how we review applications. But really, I just want to reiterate that the selection criteria that we look at for TRGS, it will be a little bit different to what you might be used to with NHMRC grants or other funding bodies. So we go through 3 stages. So at the expression of interest stage, our internal review panel will look at the selection criteria for each application. And so that's really to look at a sound research methodology, system relevance, that the appropriate partnerships are represented within the project team, and that there has been a consideration of the translation of this research into policy and practice built in from the start. So all of those selection criteria are available in the guidelines to applicants, which you can find on the TRGS website. So I'll make the URL available at the end of this session so you can know where to go. So really, I think the thing to reiterate there is, well, 2 things probably. We're really looking for that system relevance. So we're looking to fund research that is going to have an impact on how we do our business. And the other thing there is that you might notice we don't look at track record in the same way that someone like the NHMRC might do. So although we do make sure that the right expertise are brought into the research team, it's not so much about publication success or grant success in terms of who's going to be successful. So the second stage is looking at providing feedback to those that have been invited forward to the next step. And that's quite an intensive process. We do provide a lot of individual specific feedback to applicants to really address those selection criteria, to make sure that we're getting the most out of those projects that we can. And then the third stage, when people submit their full application, those applications are assessed by an independent selection panel against the same criteria. So this is the 3rd round of the Translational Research Grant Scheme, and there are a few changes that we're introducing this round. So one of the key things is that we have a priority theme of cardiovascular health. So just to be clear about what's included in the scope of that, that's heart disease, vascular disease, stroke, hypertension, and renal disease and diabetes as relating to cardiovascular disease. So although we do have this priority theme, that doesn't preclude people from submitting applications that address the other priority areas that are listed in the TRGS guidelines, but also priority areas that might be relevant to your local organisation. So as long as it is addressing one of those local or state priorities, it's still within the scope of TRGS. But the priority theme means that we're dedicating a proportion of funding towards applications that address those priority areas. So the second thing that we are changing this year is we're reducing the cap of EOIs that may be submitted per host organisation down to 5, which is a significant change from what we've done in the past when our cap was 30. So we are looking towards our host organisations to be involved in reviewing and culling or being strategic around which applications they want to submit. And to facilitate that process, we're asking the TRGS coordinators for each host organisation to be responsible for submitting those applications so that we can be assured that they've gone through that process. So if you want to find the contact details for the TRGS coordinator in your host organisation, those contact details are all available in the guidelines to applicants as well, which, as I said, are available on the TRGS website. So one of the other things that we are offering this year and building on from what we've done in the past are to provide a range of support resources for applicants to the scheme. Now, all of these resources are available on the website, and as I said, I'll just put up the URL for the website at the end of the session. But just to take you through a little bit of what we have available. So I've already mentioned the guidelines to applicants. That's one of the key documents that you'll really need to look at to really outline all the details for the scheme, so eligibility criteria, selection criteria, and all of the process details. And also you'll find the EOI form available on the TRGS website. So that will give you a really good indication of what kind of information we're looking for with the applications. We also have available the Translational Research Framework and Sourcebook, which is a resource developed specifically for this program by the Sachs Institute. And as I mentioned, Professor Don Nutbeam will be talking to that a little bit later this morning. So other than that, we also have a range of other documents, including frequently asked questions, which are really just process questions, feedback to applicants in previous rounds. So that is feedback that our review panel has provided at the EOI stage, and it's general feedback to all applicants, but it's really addressing a lot of the issues that we see come back in a high number of the applications. So I'd highly encourage you to have a look at that just to see the kinds of things that we're looking for, the kinds of things to avoid. Pardon me. And we also have an overview of the projects that we funded in round 1 and round 2. So this might be useful for you to look at because it will really give you a sense of the types of projects that we fund and the range of different projects that we fund through the TRGS program. So just to highlight some key dates for round 3, as you might be aware, we've already officially opened the call for expressions of interest a couple of weeks ago. So those applications are then due into your host organisation by the end of July. So as I said, the host organisations are playing a bit more of a formal role in reviewing and culling applications this year, so we've built that into the timelines. And then the final EOIs will be submitted via your host organisation to us at the start of September. So then, as I mentioned, it goes through the review process with the internal selection panel for the EOI review. And then we go through the feedback process, as I mentioned, providing the detailed feedback to people that are invited back to full application. And that is during the the proposal development period, which is November to January. So we've extended that period for full application development to help people to establish and develop those partnerships that we quite often ask for at that stage. So then full applications will come to us at the end of January, and the independent selection panel review process happens February, March. And we're hoping to notify all our successful applicants of their funding outcomes in March. And this is for funding to begin in July. And the reason that we've done that and moved the timelines forward a little bit is to really facilitate the project startup. So if we are able to let people know who's been successful in funding early. It gives everybody an opportunity to start their ethics applications, to start recruitment of project staff, so that when they do start their funding in July, they can really get going with the research project. So I don't think I've mentioned, but the project period is a maximum of 2 years, which is a fairly limited time frame. So we really do want to try to facilitate that project startup as quickly as possible so that your 2 years can be dedicated to your research project rather than ethics applications, etc. So I'm just going to really briefly touch on some of the key learnings that we've seen come through in the first 2 rounds of the TRGS scheme. And this is really just, pardon me, this is really just an introduction to the next 3 speakers that we'll have this morning that will be going into these elements in a little bit more detail. So I've pulled this list, so key factors in successful EOIs that are then invited to develop a full application, directly from the feedback to applicants in round 2. So I highly recommend you go and check out that document. And just as an aside, following this list is key factors in EOIs that were unsuccessful. So I really do think it's a valuable document for people to check out when they're developing their proposals. But I just want to focus on 3. So the importance of developing strong partnerships, making sure that you have appropriate research methodology and a rigorous study design, and really making sure that the translational elements and potential to scale up the project, should it be successful, to make sure that those issues are addressed from the outset. And so I'm just going to just really briefly do 1 or 2 slides on each of these issues as an introduction. So firstly, partnerships, and as I mentioned, Dr. Andrew Millett will be talking about this in some more detail following this. But I just really wanted to highlight from a practical perspective what we see and what we'd like to see with TRGS applications in terms of having the right partnerships. So TRGS is really not about collaboration for the sake of collaboration. It's not about having the more the merrier on your proposal. It's about having the right skill mix and the right expertise and the right input. So this might mean working with other local health districts where there's similar research happening currently, or where it's going to really address transferability and scalability issues. It might mean working with the New South Wales health pillars or specialty health networks where relevant. It would mean liaising with the New South Wales Ministry of Health policy branches if you're doing research that is relevant, directly relevant to the area that they're working. So you want to ensure that what you're doing is aligned with the strategic priorities. It might mean working with the ACI clinical networks where you are working in an area where there is a clinical network to ensure, again, that there is that strategic alignment. Or having, as I mentioned previously, the right academic research partners. And that's really about bringing the right expertise into your team to ensure that you have a rigorous research methodology. So all of these things are sort of tying into each other. So Andrew will absolutely go into this in more detail, but I just want to reiterate, very important to engage early. So we don't just want to see the right names on the application, but we want to see evidence that they've provided real input. And that might mean that, you know, they're informing the study design or ensuring that policy and strategic alignment, as I mentioned, and definitely ensuring that those transferability and scalability issues are addressed from the outset. So just as a quick aside, the ACI clinical networks, which are one of the key partners that I mentioned, we're making the network manager's contact details available on the TRGS website, just as an easy point of reference. You can see how many networks and task forces there are that might be relevant to a lot of the TRGS proposals that we see coming through. So I highly encourage you to see if there is anything that you can align with in terms of your proposal. So secondly, the importance of having the right research methodology. And again, I think I've pulled this list from the feedback to applicants that's available on the TRGS website. So this is all information that you can check out at your leisure. But some of the things, the key things that we need to see addressed with our TRGS proposals is that you've got a well-designed and well-articulated research question, that all of your elements of your study design are developed with a lot of methodological rigour, that your study design is appropriate to answer your research questions, and that you've got the right skills and expertise across the team to inform that. And so probably an important resource to check out, and Don will go into this in more detail, the Translational Research Framework and Sourcebook have a lot of information around this. And finally, and again this ties in, is ensuring that those translation elements are addressed from the outset. So we really want to see these considerations dealt with in your proposal. We don't want to see translation added on as an afterthought. So, the research translation plan is a key part of the EOI proposal, and it's something that is, definitely an important part of what the review panel look at. And so key things to address are how you're going to disseminate your research outputs, what formal or informal mechanisms, addressing scalability and transferability, as I mentioned, within the research design. And so that might mean including another host organisation or another local health district as a site in your study design to ensure that your intervention will work in different settings. And to really think about the sustainability of your intervention should we want to scale it up across the system. So if you see successful outcomes, how sustainable would it be to implement this across your LHD or across the state?